All right, so I'm going to show my exercises that I did to help repair my rotator cuff. I had a partially torn supraspinatus tendon in the rotator cuff and did these exercises, and I went really aggressive with them, and about a month later I was able to play tennis. So I'm going to go ahead and show them. The first one really is more of a stretch, and it's just pulling your hand up here and then pulling the shoulder across and getting a good stretch going back towards the wall. And I use this arm here as a lever. Okay, so just kind of doing that stretch repeatedly. The other one, the other stretch that I like to do is I will hang this behind my back. I'll grab it with my hand, and then I will pull up and then hang this over my shoulder so that my other hand is behind my back like this. And that's really stretching the anterior shoulder girdle or capsule right here. It puts a really nice stretch there. And so I, relax that and then repeat it and come on up, maybe a little bit higher. You don't really want to push to a point of pain. There's going to be some discomfort there. I mean, I'm not even having problems with my rotator cuff. I'm playing tennis all the time, but I'm still feeling some discomfort in that shoulder with this stretch. You don't want to push to a point of pain. Discomfort, that's one thing. We're all going to have some arthritis and things like that. So you can have some discomfort, but just don't push to a point of pain. So that is the one stretch right there, coupled with the other one like this. Okay. Now the two exercises, I call them the hinge exercises, like a door hinge. And you'll have this end taped or not taped, tied off on a knob on a desk or even a door knob or something like that that you can loop it around there. And so this is stationary. This is not going to move. And then what you do is with the right arm or with whatever arm your shoulder is hurt on, you take this band, leave the elbow tucked to the side. Don't let it flail or go forward or backwards. Leave the elbow tucked and then go out like this. Out slow and back in slow. Out slow and back in slow. And repeat that until your shoulder gets tired. Then you'll have this here, and you'll have it tied over here to a doorknob on this side. Okay. And then you hinge it in this way, in and back out, in and back out. So it's actually good to have two of these bands, and then you can tie one on one knob on the desk on the right side, and then on the drawer on the left side, tie it to that knob, and then you can have it to where you can go, this way with the one that's over on the right, and then the one that's on the left, you can pull out and go this way. Or do the same thing with a doorknob. If you tie this onto a doorknob, you can go on one side of it, and then when you finish with that direction, go over on the other side and pull the opposite direction. So however you want to do it, but be really aggressive. That's what worked for me. Do it, at least 3 or 4 times a day, preferably 6 or 8 times a day to fatigue. So that could be 3 reps, 1 rep. It could be 30 reps, but do it until the shoulder gets tired. And then that's when you've had enough. Awesome.